The oral appliance works in the sense that as we're sitting up, without the appliance in, our jaw's in the right position and our airway's open, and we're able to get the oxygen that we need just as we're awake. When we lay down and sleep, what happens is our jaw falls back a little bit, and our tongue falls back a little bit as well. And so the airway starts to narrow, and as we're sleeping, our muscles relax in our airway. And so the two combined makes, for some people, if it gets too narrow, the oxygen trying to get through there causes a vibrating sound or a snoring sound, and sometimes even obstructs or closes. When that happens, that's called obstructive sleep apnea. So the appliance, what it essentially does, there's an example one here, this is the top jaw and the lower jaw. What it'll do is it'll prevent the jaw from falling backwards. That way the person's airway is more open, allowing the oxygen to go through, and that way we don't have the the narrowing and the snoring, the obstructiveness that happens as we sleep. So it just basically keeps your jaw forward so you don't able to get the air that you need. The appliance works, and I'll let Richard try it. He's just going to put it in, show you how easy it is to put in. It also lets you know kind of the positioning of the jaw and how easy it is for him to wear. So here you go, Richard, try that. So it kind of snaps in. It's a little snug, so it's not going to fall out in the night. We just have some bars here that just kind of help the appliance to keep his jaw from falling backwards, and when he's sleeping, laying back, it's just going to keep that airway open for him. The nice thing about this appliance, and especially for grinders or clenchers, people with bruxism, this particular one has a little bit of movement in the jaw so that they don't get a sore jaw at night. And so what's nice about the appliance, you can see it keeps Richard's profile nice. He doesn't have the jaw falling back, and that way when he's sleeping at night, he's going to keep that airway open, and he's going to get the oxygen he needs, preventing the snoring, all that sort of things. An extra nice thing, but the more important thing is that we're treating the sleep apnea, and he's getting that oxygen he needs so that he doesn't get the high blood pressures and the increased chance of strokes and cardiac events and whatnot. So essentially we've got a good product here to help him to sleep better.